Patient with severe oligohydraminos and fetus has got cardiomegaly with pericardial effusion. Here you can see 4-chamber heart in 2D. Now we will put color and you can see normal heart flowing. Both atria and both ventricle moves freely. Apex to crux ventricle are seen. There is very well moderator bend seen in right ventricle. This is moderator bend seen in right ventricle. This is left ventricle. This is left atrium. This is right atrium. Here you can see very well two venous sinuses. This chamber is right atrium. This chamber is right atrium. You can see inferior vena cava coming down and superior vena cava going up. So this is typical right atrium. Now I am going above. You can see this is aorta. This is aorta. I can trace aorta up to. You can go and you can trace aorta. This is acoustic. This is aorta. You can continuously tracing aorta down. Tracing aorta down. You can trace aorta upwards, and here you can see 3 neck vessel which is going up. Here you can see three neck vessel, typical neck vessels, 3 neck vessels you can see here, 1, 2 and 3. I will show you. This is 1, 2 and 3. Three neck vessels are going on. At this juncture you can take aortic fundal flow. This is aortic fundal flow. Now we will see what happens to the ductus. Here you can see aorta, vena cava, and here you can see my friend very well aliasing ductus venosus. Can you imagine this ductus will be normal? Absolutely not. You can see ductus is abnormal with reversal of flow. M is totally big. To make ductus normal, I can put this waveform small. Now you can see ductus is totally abnormal with reversal of flow. Because of cardiomegaly and pericardial effusion, you can see anatomy very well. There is dilatation of the left atrium as well as right atrium, but both ventricle looks normal. Now we can trace ductal arch also from here. Put color. You can see this is aortic arch, and below aortic arch you can see the ductal arch. Aortic arch will give rise to 3 vessels, while ductal arch is connection of right pulmonary artery with the aorta. And at this juncture we are taking the aortic fundal flow. At this juncture we are taking the aortic fundal flow. So this baby has got severe oligohydraminos. You can see there is little bit of abnormal flow in umbilical artery also. Because of oligohydraminos, you can see there is deviation in the head shape also, but you can very well see the head anatomy, transventricular, transthalamic, and here you can see very well cerebellum. You can also put color to see the vascularity in the heart. You can see this is middle cerebral artery. It is also dilated one. You see this is middle cerebral artery, just looking like umbilical artery. Okay. This is typical MCA footprint. Here you can see MCA footprint very well. Dilated umbilical artery, middle cerebral artery. If you measure middle cerebral artery by auto trace, it is 0.66. So here you can see umbilical become MCA and MCA become umbilicus. This is 0.66 is normal RI for umbilical artery. Now it is for middle cerebral artery. Again see the heart anatomy is very well, and the patient has got dysplastic kidney. Here you can see kidney which is dysplastic, white color kidney. Here you can see this is white color kidney. Usually kidney we can't see on this ultrasound, but because of dysplastic kidney it looks white, so it doesn't get blood supply that much. Because kidney is not getting enough blood supply, there is severe oligohydraminos and bladder is also not filled one. Here also you can see umbilical artery. This shows abnormal pattern of revulsion. Absolutely no liquor. Severe oligohydramnios. Even stomach bubble is not filled one because patient has got no liquor to drink. Stomach bubble is seen but very flattened one. Again beautiful right ventricle with two vena cava and ductus. Here you can see ductal anatomy very well. Here you can see ductal anatomy very well. Here ductus is going. Typical ductus with deepening of A wave. See, A wave is going quite deep. This is ventricular systole, ventricular diastole and atrial systole. It is going very deep. Thank you very much.